Courage to Rise show. I'm Katie Cianci, your host. I'm excited to have our guest, Dr. Nisha Chellam. She is a functional medicine doctor. She also provides a lot of wonderful, amazing education. And so we're really excited to have you here with us. And I first wanted you to be here specifically because in looking at adversity, since Courage to Rise is a lot about looking at adversity, part of adversity is chronic diseases, trauma, and I know that they're related in some way, you know, from the research that I've looked at, and I know that you touch on that. And so your knowledge and expertise will be so valuable for our audience who are watching. So welcome. And
thank you so much.
Yes. And so would you mind sharing a little bit about, you know, how you started, because you were working in the traditional field of medicine, and then now you've transitioned into this incredible world of functional medicine. Do you mind sharing how that started?
Absolutely. So, you know, when you come from India, there are only two career paths you can always take. One is you get to be an engineer or you get to be a doctor. So as far as I remember, I always wanted to be a doctor, and I have no idea why, but it was something that I had worked all my life. And in India, you go to medical school at the age of 17. Oh. And I walked out of medical school and the practice of medicine 3 times in my life. And the very first day of medical school, I walked out. And then I walked out soon after I finished my medical school. And with the birth of my first baby, I wanted to quit. And one of the reasons I could not realize, I just didn't enjoy it. Once I walked into the field, I did not enjoy it, but I could not pinpoint what the problem was. But somewhere, you know, I call it mindless medicine. You see patients, you diagnose them with the disease, you connect them to a drug, or you send them for more testing or to a surgery to get something removed if it can be removed, like a gallbladder or a kidney stone. But people never got better. And I never understood that for a long time. And usually it's a patient that teaches you. And one of my patients, a young man, I still remember, he had severe osteoporosis because he didn't have a colon. And he had very poor bone density. And he didn't see me for almost a year and a half. When he came back and I redid his bone density, he actually increased his bone density without taking the medicine we recommended he should. And that opened my eyes to something very different. Traditional medicine diagnoses disease and connects it to a drug. And this man showed me that you can actually get to the root cause and rebuild your health. So I started looking for a way to learn that with science backing it. You know, if you can do a lot of things, we've been taught about diet and exercise, in the sense, go on a low-fat diet, low-calorie diet, exercise a lot. And I've had patients who can never lose weight and fall off track. So our knowledge of what an individual can do by themselves to heal was very minimal. And that's how I came upon functional medicine. And just for your audience to understand, so they don't get confused between holistic and integrative and functional medicine doctor asks only 2 questions. What does this person need in order to heal? In other words, what are they missing? What do we need to give them? Or what do we need to remove so they may heal? And my journey into functional medicine began with my own problems, where I was gaining weight, I was losing my hair, and I could not sleep at night. I was tired in the afternoon, and I used to work long hours in traditional medicine. You know, start at 6 a.m., go to hospital rounds, see patients, complete nursing home rounds, assisted living, and go see my hospice patients. There was a lot packed into a day, and I did not have energy to do anything. So my life basically suffered a lot. I didn't have a personal life till I found functional medicine, and I worked on my own health, and I realized I had Hashimoto's, and none of my blood tests showed it because I didn't do the right blood test. So it took me on a different journey, and I realized the way I practice medicine did not bring joy to me or my patients. And that's how I always tell people, I'm a recovering physician. I stopped being a physician and started really working in a partnership with my patients, helping them heal in that journey. And that's how I became a functional medical doctor. And that's what I've done for the last 2.5 years, 100% functional medicine.
Oh, that's amazing. So do you have I used to work with a lot of physicians when I worked in the hospital, and I saw that, and patients, right? And you'd see a lot of patients keep coming in
Yeah.
with the same issues. And one of the things that I would ask is trauma. I started to notice like a pattern. A lot of these
Yeah.
patients, as a social worker, I'd ask them, they just share their story. And a lot of them had trauma with chronic conditions. And then we have recently there was an ACE study. Well, actually not that recent, but it's
Yeah.
starting to
It's
become
been
more
around.
prevalent.
Yeah.
Yeah, it's been around for a long time. And a lot of people don't even know what the ACE study is, but it's starting to become more prevalent. So do you mind sharing a little bit about like how disease and, you mentioned how disease and trauma and what are, how do you know what's a disease or what's really there's an underlying issue?
Yeah. So there's a book called Disease is a Delusion. And this was by Dr. Jeffrey Bland, who actually is considered the founder of functional medicine.
Yeah.
And when you look at, do people really get disease? Is a disease a natural part of our aging process? And you'll realize disease is not natural for us at all.
Yeah.
Disease happens because something shifted in our environment. And a lot of times, adverse childhood events are such a major role. It's almost like, I think the data says 65 to 80% of patients who have had adverse childhood events usually die of chronic diseases. And a lot of it could be a mental disease process like depression, anxiety, but also addictions. And you'll find that the adverse childhood events are never addressed. A lot of times we talk about what you call child protective services. That becomes when it's very obvious. But there are some children that live this life and no one knows what's going on in their home. They don't realize that their mom might be ill, mother may be suffering from generalized anxiety disorder. There may be physical or verbal abuse at home, which nobody gets to know outside of the home. And most children are very quiet and reserved. They just observe this. Sometimes they may feel emotionally neglected. Nobody's hugging them. Nobody's showing any love and affection. Or they may have watched their parents drink. And there are so many functional alcoholics. And if both their parents drink, there's a certain environment and energy in that home that creates a sense of doom in the child. And then there are other instances where one of the parent actually gets arrested. Let's say it's a DUI, or for drug use or for peddling drugs. Somebody gets arrested. There are so many events that it's not as simple as the child was abused or there's something dysfunctional in one of their parents. It's just the environment that the child grows in. It's very stressful. And many of these children learn to protect themselves by different coping skills. They either get quiet and do everything that their parents want them to do, so they try not to make their father or mother angry with them. They're scared of the wrath. Or they tend to be very perfect and try to do everything perfectly. They second guess themselves. So as adults, there's a worrying tendency. They grow up with this worrying tendency, and little things set them back. And they begin to have low self-esteem. They begin to be very obsessive compulsive in their work. And constantly, it's almost like, I would say these are the people who put their foot on their accelerator and there's no brake. Constantly go, 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 because there's that feeling of self-worth is not there, and they're constantly trying to achieve. And what you find is many of these folks actually don't seek help early enough. They actually wallow in this constant stress, worry, poor self-worth. And this leads to certain hormonal dysfunctions. And over a period of time, they too may develop the addictions, and then you have the chronic disease. So it's a very sad aspect of upbringing that a lot of times we don't address long enough. You'll find many of these children go to counseling, and they're with counselors for like 35, 40 years without resolving their problem.
Mhm.
And I always tell people, you know, in 5 years, if they can't get you better, you need to find a different counselor. There
Yeah.
are ways to help folks, but they just live in this and they talk about their past so much. You know, this is a question I asked just to give you an example so the audience can follow what I'm saying. When you're looking at an athlete, right, and like say basketball, how does somebody get to be good at it? And everybody tells me it's because they practice. These are children who, when they have adverse childhood events, they practice the story over and over and over again over decades, and they become so good at staying anxious and depressed. Of course, it takes time, but we got to, break that loop and get them to live somewhat, accept and let go the past. It's a very difficult journey, and that should be the goal of any counseling that you get. It should not be the goal of counseling to practice again what you've been through,
Yeah.
because it doesn't make sense.
No.
And that's what I find is really broken down in the therapy world, where they teach people to understand where they came from and why they are there, but they need to move them forward.
Mhm.
And I think that would be the biggest missing piece if somebody is struggling with adverse childhood events, the ones that I mentioned, and then struggling with worry, depression, and then developing diseases like high blood sugar, high blood pressure, or high cholesterol can be actually a huge part. Or problems with thyroid. In fact, the thyroid fails in most people who have stressors.
Mm.
And weight gain, obesity is a sign of a lot of emotional trauma too. So we can go through a whole list of it, but I just wanted to give you an idea of how much the adverse childhood events really impact your current health.
Yeah. Well, thank you for sharing that, because it's so true. And I completely agree with you on therapy. I mean, that's definitely, I've shifted how I was trained a certain way, and then I've shifted
Yeah,
because I noticed it doesn't work. It doesn't support someone. It's like, okay, you acknowledge right now that the past is coming to the present, acknowledge that. And then, and then you do some work on that, and then you move on. Okay. So now what do you get to create from now forward? And that really seems to help people move faster. They actually
right.
get to see results. And then how does it affect your health? Because that's another part too. I mean, I remember having people come in with a list of medications, and I'm like, whoa. So as I do my history, I noticed there's an attachment injury, like meaning they had a divorce. There was a divorce early in childhood, and they didn't realize that that was contributing
Right.
to what they are experiencing now. And
Right.
it's remarkable when they're able to really get to the root, and then see how it affects your entire body. It's not just something happens and it doesn't affect you. It's your entire
Absolutely.
body.
Right. I more than acknowledging, I also tell my patients, thank your life for giving you that experience, because it makes you who you are. Because we got to thank these adversities, because it helps you shift and change. Either they always say trauma can make you bitter or better. And most of the times when you choose the better, you really want to go forward and not stay stuck in the bitterness of everything that had happened. That's amazing, that in your own profession, because a lot of times we depend on people like you to help you know patients move forward. And it's very important to realize that therapy needs to move people forward and not stay stuck in the past.
Mm-hmm. Yeah, that's true. And so what do you think happens, like, as far as the thyroid? You mentioned the thyroid, because that is really important. A piece that's missing in a lot of assessments.
Absolutely. Because I personally, for women, if you line up 10 human beings, um, really 9 out of 10 of them will be women. They have a lot of thyroid issues, and there are several reasons for that. So the thyroid is considered, like in functional medicine, the canary in the coal mine. So the coal miners actually carry a canary in a cage to get into a coal mine. And if the canary dies, then the gases in the coal mine are toxic. So they actually step out and they won't go in. So when you have a thyroid problem, it's actually a canary in your body telling you that that things are not well.
Mhm.
So a thyroid, I call it like the pituitary, which is the one in the brain that controls all of the other glands, is considered the master gland. For me, the thyroid is truly a master gland because it's easy to assess, and it's a very and only produces this one hormone that we really, I would say, the main hormone is that we call it thyroid hormones. It produces more than one, but we focus on the thyroid. And when you have those symptoms, you really need to dig into all of the physiological processes in the body. So the thyroid, everybody remembers the thyroid as if I have weight gain, it must be my thyroid. But that thyroid is your metabolic hormone. It is your ignition. However, it also affects every cell in your body, every cell. There's not any other hormone other than vitamin D, activated vitamin D. These are the only two hormones that affect every cell in your body.
Mhm.
And what it does is it gets into the cell and it turns on genes that really create those actions, growth of hair or the suppleness of your skin, the sharpness of your brain, your bowel movements, the muscle strength. People with low thyroid will tell you they have cramps and muscle pain constantly. And everything is controlled because not only the metabolic rate, but even the growth of all these cells are controlled by the thyroid.
Mhm.
So the thyroid tends to slow down the minute there is stress. So what are stressors? It's not always um, bad stresses. Like for instance, pregnancy is a stress on a woman's body.
Mhm.
Every time a woman is pregnant, her thyroid is inflamed. And what the studies have shown, by the third pregnancy, you really lose over 35% of your thyroid gland, which
Oh.
is a significant part. And we look at women who have babies, they're depressed, their hair is falling. We talk about the estrogen, but a lot of it could be the thyroid too, especially the mood. So it's very important to check the thyroid following pregnancy. Now, in traditional medicine, it's very interesting what they do. And this is something that I've done too. I should not say they, I should say we do. Um, when a woman is trying to get pregnant, they'll look at a thyroid, they'll say, your TSH could be better. We need to give you a little thyroid medicine during your pregnancy to sustain your pregnancy. But soon after the baby's born, they'll say, it's a part of your pregnancy and you can stop your thyroid. And I'm like, here's a woman who you thought was too hypothyroid to have a baby.
Mhm.
Now, after the baby's born, why would we take away that support? She probably is still hypothyroid.
Yeah.
And that's why they tend to have mood disorders, weight gain, hair loss. And it's like, continue that and let's reassess if her thyroid has actually recovered. And a lot of times we don't do that because most of us go to our doctors maybe just once a year. And you want to assess this every 3 months till you feel comfortable. Your mood is better, your hair has stopped falling, you're able to get rid of your baby weight, post baby weight, because you've gotten back to normal rhythm, of things where you're getting back to your exercise, eating fairly normally, and whatever else, and going to work. But nobody ever does that. So I feel like if you're struggling with depression, I say this all the time, your depression and anxiety, doesn't matter what your adverse event that triggered off this,
Mhm.
maybe you cannot be truly diagnosed with primary depression or generalized anxiety disorder if your thyroid has not been checked, B12 has not been checked, and your gut health has not been checked. I
Mhm.
think that those three things are so crucial in order, and liver, the gut comes with the liver.
Yeah.
They're very crucial in order to determine, is this person having true um, primary depression, where, there's just a chemical imbalance or they have a genetic trait. Most of them, one of these is amiss, and we need to identify and rebuild health from within, if that makes sense.
Oh, absolutely. I mean, that's definitely something to check, and as if there are any therapists that are watching, I mean, that's something too that we are trained, before we give a diagnosis, because, there's so much stigma still, unfortunately, with mental
Yes.
health. But yeah, we need to rule out any medical, and there's physicians that will write a prescription for depression, And I mean, it happened with a friend of mine recently. I said, well, did they check your thyroid? Did they check your vitamin B? Did they do a full workup? And
Right.
she's like, oh no, she just wrote me a prescription. And
Yeah.
then it wasn't effective. It wasn't working. And I was like, well, there you go. Like,
Yeah.
So it's important for us, I think, would you say, like, to be an advocate for yourself, to have this knowledge?
Right. And I think the times have changed. I
Mm-hmm.
think in this world of so much of information, we should not be chronically ill. And patients need to realize you need to be in a partnership with your physician. You cannot go there like a child that's broken and say, I'm going to complain to my, somebody who's superior to me about my problems and they're going to be fixing it. No, most of your problems are from within outward. You have a discussion. What should I be looking for? Are there other things that we could test for before? Because I've never been depressed any time in my life, but I feel like I have no drive to do anything, and this is not me. In fact, a lot of thyroid patients will describe themselves as, I've become lazy. You feel the laziness because the drive is gone. But it's so important to find a physician who actually has the time to sit down with you and listen to your story and delve a little deeper into what else might be causing this depression rather than giving you a diagnosis of major depressive disorder.
Mm-hmm.
And I think the reason for so much of I don't know it's like almost a frustration in the system today for both doctors and patients is the time element.
Mm-hmm.
And doctors are overwhelmed and underpaid. Psychiatrists, particularly, a lot of health insurances don't cover psychiatry like they should. So most psychiatrists work with a therapist, and the psychiatrist believes their job is, let me give a medicine, because they would be sued if they didn't treat a patient with a medication and the patient went and killed themselves. If you actually have given a medication, then you're safe from a lawsuit. Do you know what I mean? And it's crazy how the system is wired. So before we blame our doctors, we need to understand where they come from, because they can talk to you all they want, but if you complain of depression, you got to prescribe a medication to make sure you're not going to go off and do something that is going to be irreversible.
Okay.
So yeah, and also finding a psychiatrist who's not booked like 25 to 50 patients when they're part of an institution. That's what happens. They're booked back to back, and you have hardly 10 minutes with your psychiatrist. I mean, that's crazy.
Mm-hmm.
Because people come in with pent up emotions. They want to talk about it, and we tell them, oh, don't worry, I got a fix for this. No, they don't have a fix. They have an ability, these medicines have an ability to bring up your chemicals for the moment, temporarily, but you got to get to the root cause and rebuild your health.
Mm-hmm. Yeah. So how would someone begin to explore this? I mean, is there a certain kind of physician that I mean, you said functional medicine, where would they find someone who would be able to really take the time and has the training to look a little bit deeper?
Yeah. So depending on, I say that this is for the patient, right? Your health has to be your priority.
Mm-hmm.
Because just like with anything, I went to a restaurant the other day and I was asking for a specific dish, and the dish had something that I don't eat, like, let's say cheese, and I wanted avocado in its place, or mushroom. I think it had something, and I asked them to remove the cheese, which was like a huge part of their price of the dish, and then I said I want it replaced with something equivalent, and they charged me $2 extra. And I keep thinking, all right, I gave you back something and I'm asking for something in its place. I mean, it's almost looks like an equal swap. Why am I getting charged extra? Everything like that is extra. So if health is your priority, you need to invest in it.
Yeah.
Because when you talk about a partnership, whether it be an integrative physician or a functional medical psychiatrist, they're going to spend time with you to delve deeper. We call it the timeline, right? We get into how your mother's health was when you were in her womb.
Oh.
That's where all of this begins.
Wow.
And then we go through the major life events. So for this to happen, my initial encounter with the patient is almost 2.5 hours when they fill the history and I go into it. So number one, you need to first go in as a partnership, which means prepare your history really well. Go through your life events. Every individual who's depressed and anxious, even though they come and say, I don't know why I'm depressed, knows why they're depressed. There was always an event that shifted their lives. Now you find children depressed, right? At 10, if you talk to them, there was something, either their parents moved the home and they lost a best friend, they lost a pet, or the parents fought, or there was divorce. Something happened that shifted the child, where the child took it inward and didn't know how to interpret this, but it turned out to be, it manifests itself as a depression. So you need to identify those events, and you need to have a discussion with a professional who can actually look at those events and see, what does this do to a person's health? Because they view it very differently than you do. Though I will say most of my patients will tell me what they are most resentful about. They know it. It's just somebody has to ask that question. So go to somebody who's trained in functional medicine if you're done taking medicines. And if you are really looking to, I want to get to the root cause of it, and I don't want to live my life this way, constantly anxious and depressed. I really want to live a full life. I call it a life of excellence. Then you got to find a functional medical psychiatrist or a team. Even a therapist can work with you. But here's one very important advice. Never stop taking your medications if you've been on it, and never refuse medicines if you feel totally miserable. Medicines have their place. They were always designed for temporary treatment of a temporary problem, but they kind of prevent you from going over the edge. And then work with somebody who knows how your gut health impacts, how your hormones impact your mood, how your vitamins and minerals impact the production of your neurotransmitters, which is what you're trying to build up when you give antidepressant or anti-anxiety medication. You need to get to all of that testing and rebuild your health from within. And most patients will feel like, I don't think I need my antidepressants now. And in acute phases, I would say an antidepressant, the maximum time you should use it is for 6 months. And so by 4 months, you should have started rebuilding your health and be able to wean down your antidepressants.
Yeah, so many people have them for the rest of their life. 20, 30 years.
I know, it's very sad. It's very sad because they don't know any other way. And that's one of the reasons why we do shows and summits like these, because there is a different way, and you need to know where to get this help.
Yes. Well, thank you. Thank you so much. And you are also offering, there's so much that I would love to cover. I'd love to do this again at some point.
Yes.
And then you have a website. I'll be sharing it with everyone that is listening as well, so they can connect with you, because you offer a lot of education and value.
Yes. We actually do a lot of webinars. We do have online courses. And people can also join smaller courses, larger courses, so they can do a lot of things on their own, or they can do it with support. Absolutely.
That's wonderful. So would you like to introduce the free gift that you're offering?
Yes. So I did what is called a consumer's guide to thyroid disorders. I think there's so much of confusion about thyroid disorders in general. And in the consumer's guide, you'll get to find out what are the tests you should be asking your doctor, and why you should look at your gut health and liver health and not just the thyroid hormones. So there's a lot of valuable information in that consumer guide.
Oh, thank you. Thank you so much for your time.
Thank you. This was an honor. Appreciate it.
It was. So much valuable information. Well, thank you all for joining us, and I will see you for the next episode tomorrow. And feel free to check out our Facebook page. We have a wonderful community that's building there, and a lot of our speakers are actually coming on and providing some additional education and value. So check that out and enjoy the rest of your day, and to remember to blossom with purpose. Take care. Thank you. you.